What are the most common athletic injuries? And what are the most effective treatments?
On this week's Health Talk, an orthopedic surgeon and a physical therapist will be here to tell you what you should know about athletic injuries and their treatments.
So stay tuned to hear how to get back into being active. We're up next. Hello, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Our guests on Health Talk today are Dr. Robert Brady, he's a Norwalk Hospital orthopedic surgeon, and Steve Irwin, he's a senior physical therapist also at Norwalk Hospital. We're delighted to have you both on the show.
Thank you.
This is a topic I think that is just so important to everybody, athletic injuries. So I guess almost everybody experiences it one or more times in their life.
Yeah.
So, and what are the common ones? Robert, what do you see in the office most commonly?
Right.
And then we'll get a little bit into treatment.
Right. So, I mean, for me, again, the fall season is when people really start increasing their sports activities. You know, they take the summer off to kind of hang out, and then, you know, with especially the high school sports and the competitive high school sports, we really start to see in the preseason different types of injuries. So during that kind of beginning season, we see this, you know, kind of the sprains and strain injuries that their bodies aren't used to moving the way they are, so the way they should be, and so we start to see those injuries to the, you know, hamstring pulls, groin pulls, ankle sprains, you know, spine muscle sprains. So those are the most common in the preseason.
Could you just, for people at home, as well as for me, what's the difference between a sprain and a strain?
Right. You know, it could be used, you know, universally. You know, the sprains typically refer to ligaments, and strains usually refer to tendons. So it's, you know, the ligaments just connect bone to bone, tendons connect muscle to bones. That's the typical nomenclature, but I think you can use them interchangeably.
Steve, what are some of the most common sprains or strains you see, and how do you like to treat them?
So probably the most common ones I see are more in the center of the body, because we see a lot of hip flexor strains, we see a lot of hamstring strains, Achilles tendonitis, a lot of kind of acute inflammatory conditions where we can kind of have a little bit of influence over the healing process rather than letting it get too chronic where it's kind of gotten out of control. So at least in therapy, we try to use some modalities to try to reduce inflammation in the area, kind of provide gentle stretching to the area, and then strengthen areas around the injured tissue to take some of the pressure off, you know, that specific area of injury. So that's kind of the approach that we try to take in therapy.
And how about you? What treatments do you always turn to Steve for physical therapy, or are there things that you
Steve is my man. He's the go-to. Yeah, I mean, this is usually, you know, with these strains, you know, the typical treatment is what we call RICE, which is rest, you know, ice therapy, you know, using that 20 minutes at a time, you know, 3 or 4 times a day. You know, compression if you need, you know, if you have a, you know, area that's kind of swollen, using ACE bandage or some type of support. You know, elevating if you have some swelling, and then using our physical therapists to do modalities, you know, gentle stretching exercises to help to get them back to.
How about the use of oral anti-inflammatory agents like Motrin or
Correct.
Advil or aspirin? Are they useful in treating sprains and strains?
Absolutely. You know, the non-steroidal anti-inflammatories, Advil, Motrin, Aleve, or prescription strength anti-inflammatory. If you have a really severe acute injury, sometimes we'll put you in a low-dose steroid just to really, you know, knock down the inflammation.
And what's the balance, Steve, between rest, say, to an area of the body, but not wanting to have prolonged immobility, which I understand can set up other problems?
It's a delicate balance, you know, and a lot of it depends on how acute the injury is. You know, if it had just happened, the rest is probably the most important part because you don't want to overstrain the tendon or the muscle. If it's more chronic in nature, you can get a little bit more lax with your amount of activity because usually there's not as much of an inflammatory component to it. You're kind of seeing more kind of small degenerative changes within the tissue. So that's where we try to almost remodel some of the tissue to kind of get it back to where it should be.
Maybe we can go through some of the specific injuries that I think about. A rotator cuff, which I know is the shoulder injury, and I know that's a little bit different between a young person and an old person, isn't it? So maybe you could say a couple words about that, because that surgery is indicated for some of those folks.
Yeah, I mean,
right?
the rotator cuff injuries typically, in young athletes, they're usually some type of, not catastrophic, but big injury going to happen to that player. That rotator cuff injuries are usually more of a degenerative process.
In the older people.
So more, kind of older people, kind of weekend warriors. So that's typically what we see. That there's some degenerative process of the fraying of the tendons to the rotator cuff.
What about knee injuries?
So I mean, there's certainly different types of knee injuries. I mean, the most common sports knee injury that we see in our young athletes is something called patellofemoral syndrome, where the tracking.
I have had that, so I'll tell you that.
Exactly. So the tracking of the kneecap, tends to get off a little bit, maybe, and that may be a muscle imbalance issue. So strengthening our quads to help with the more proper tracking and balancing the muscles around the knee are important. I mean, you certainly can see, other strains. You can see tears. ACL tears is a common one that we see in our running athletes.
Are ACLs more common tears in women than men, or are they about equally distributed? I had heard once they were more common in women, but I don't know whether that's true.
I think the latest literature is that they're probably more common in women. Just depends, and there's certainly sport specific.
And in the young athlete, do they often require surgical intervention?
ACL tears in young people who want to remain competitive are most likely, if it's a full tear, are most likely going to undergo surgery.
Mm-hmm. And then I assume that physical therapy then becomes very important once the athlete's undergone the surgery.
Yeah, so once kind of Dr. Grady is done fixing them up, it's kind of our job to kind of get them back, moving again, and then trying to get them to return to their sport, if not at their optimal level, but maybe even a little bit better than when they were before surgery.
I will say again, I had mentioned it when I was younger, and with skiing, I developed knee pain, and I went to see this is actually before I even moved to Connecticut,
Yeah.
and I developed knee pain, and the orthopedist pushed the patella up to the femur, and the pain was terrible, and I was afraid it was going to stop skiing forever,
Right.
and I was really amazed. I did the quad strengthening exercise. I just say it's not hocus pocus.
Yeah.
It really works, and I've not had that pain ever
Right.
ever again, and it just. I want just for viewers at home. When they say go home and build your quads up because it helps align that patella,
Correct.
that it works. It's
Right.
not magic, and it's not, as I said, it's not hocus pocus,
Right.
but it really makes a difference.
And in addition to the quad, especially with patellofemoral syndrome, a lot of people, focus on the knee, but also the ankle and the hip play very important roles with the knee. So, one thing we really look at is a specific muscle in your hip called your glute medius, which is really important for kind of helping your knee track medial and laterally, which has a component to preventing that kneecap from slipping from side to side.
You read my mind, because I was just going to ask, it's really important often to address the joint that you think is a problem, but sometimes that can cause problems with other joints too, can't it?
Sure, absolutely. The concept of just targeting one specific area that's injured, you can get that area to heal and deal with the inflammation, but there's some maybe a generalized disconnect or disequilibrium in other joints that are causing, especially these repetitive stress injuries. Runners that run, that they're very competitive, but they may be running in a way that is putting stress on either their knee or hip or ankle, that everything has to be in balance.
And I imagine, Steve, that if you are trying to not take care of an injury, say in your right ankle, your body mechanics can be off, so then you can develop a problem in the other side.
Absolutely. A lot of people call them sympathy pains. It changes your mechanics of how you walk. So any lower extremity injury on the right side, you may develop some issues on the left side just because it's being overworked. So that's why we want to try to correct any issues as quickly as possible and kind of return you to some sense of kind of symmetry. That way you're not overstressing one side of the body more than the other.
So this is something that requires professional assessment when you see somebody with this type of injury. Are you recommending someone see a physical therapist and to figure out which muscles or how the mechanics are altered and get them back in shape?
Typically,
this isn't something people can figure out at home, is it?
correct. Typically, we always kind of refer to the doctor because we want to make sure that we're not missing anything important, whether it be a fracture, some sort of tear. But once you get cleared from the doctor and kind of come to us, we like to follow a certain kind of guideline and healing process.
I don't think any discussion would be complete without a discussion of tennis elbow or what golf, the
You're
condylar,
only talking
epicondylar.
about your own injuries, Eric.
But somebody said once you get old enough, you get to experience almost everything in medicine. But maybe you should talk a little bit about that, because that really affects so many people. And it really, I was surprised when I had it years ago that how uncomfortable it was and how persistent it was.
Right. Yeah, I mean, Steve can probably talk to this more about this, but tennis elbow, golfer's elbow, those are repetitive stress injuries, and typically it results in an imbalance between the flexors and extensors of your wrist and elbow, and that's what's going to create the problems. And so that's the goal with physical therapy is calming down whatever inflammatory conditions going down there and balancing out those muscles.
Absolutely. And tennis elbow, you don't just get it from tennis, as you probably may
You don't
be
play
aware.
tennis.
Exactly. So, just for an example, a physical therapist
Do you get it
that
from
I work
eating too
with-
much?
Well, it's very possible, but he's doing home improvements and he's doing drywalling right
Yeah,
now.
that makes sense.
And he is having significant pain in his elbow just from doing repetitive motions
Right.
of painting and doing drywall. So, and he's trained in this, and this happened to him. So it can happen to anyone,
We have a little under 30 seconds left. Last thoughts for our viewers about sports injuries?
So I think with regards to sports injuries, it just depends on what level you're at and the age of the athlete. With our young athletes, we want to make sure that they're cross training, getting exposed to different sports. With our older athletes, we want to make sure that you're just warming up properly and making sure that you're going in with a conscious mind of how competitive that you want to be and can be.
And not to sing your praises, but I think if you get an injury, get professional help, because it sounds like you really need to figure out what the injury is exactly and then how to
Move forward.
treat it and prevent it in the future, which is fairly specific.
exactly.
Great. Thank you both so
that's
much.
Great. Unfortunately, I wish we could talk about this all day. It's all the time we have. I want to thank our very informative guests, Dr. Robert Brady and Stephen Irwin. Thank you, gentlemen, for coming on the show. Really appreciate it.
Please do send us your questions and comments about Health Talk to healthtalk@wchn.org.
Thanks so much for watching.
Stay safe and well.